Thanks for that, Alyssa. Well, COVID-19 vaccinations are now available for children ages 5 through 11.
And we're starting to see more and more clinics pop up in our area. Joining us this morning from Gundersen Health System to discuss getting a shot for your child is Meller. Thank you so much for joining us this morning.
Thanks for having me this morning.
So why is the vaccine so important for this demographic?
So overall, we know kids have very mild diseases, but when you have a mild disease, it means you're more likely to spread it to others. And so with kids being back in school, full time, with family, like with the upcoming holidays like Thanksgiving, Christmas, kids can spread it to family members and grandparents. So it's really important to make sure that they're vaccinated now.
And what does getting the vaccine mean for those kids? Obviously, we know the holidays are coming up, but also with school.
It means they're less likely to miss school. If they've been exposed to someone at school, they might not need to quarantine because they've already been vaccinated, which is something that for an adult is really important as well, not missing work. And so making sure that kids have that socialization time because they're vaccinated is so important.
There's a lot of different options out there and it can be overwhelming. So when and where can parents take their kids to get the vaccine?
I agree, it really is overwhelming. Gundersen has made it really simple. So right now, our vaccines are offered at our La Crosse and our Onalaska flu shot clinics. We are working on other sites, including primary care doctors, pediatricians, and those will be announced shortly via our social media and our website.
Even some of the parents I've spoken to have had some hesitation when it comes to getting the vaccine. What would be your recommendation to them for that hesitation?
Well, one of the things we are starting to see with kids, especially with the Delta variant, is we're seeing an increase in the number of hospitalizations, and we're also seeing this really serious post-inflammatory condition happening after a COVID, like even a mild COVID infection. And we know that the vaccines can prevent that. And so what I would encourage parents to do is really make sure that their kids are vaccinated, because it's the difference between having, risking hospitalization and a serious long-term condition versus having, guaranteed a very mild condition with just the sniffles.
Well, Megan, we always appreciate your time, and thank you for joining us this morning.
Thanks for having me.